morning, Miss Vaughn. How are you doing?
Fine, how you doing?
All right, my name is Rosie Hutchins. I'm one of the student nurse practitioners with Alcorn State University.
Okay.
And I'm here today to do your physical and go over some information with you.
Okay.
Okay. Do you have any questions or anything so far?
No, ma'am.
All right. First thing I'm going to do, I'm going to ask you a series of questions about your past medical history and family and stuff like that. And then I'm going to assess your head, your neck, and then we'll do your lungs and thorax. Okay? Okay. So we'll start off with the questions that I need to ask. What brings you in today? What's your chief complaint today?
Just my wellness exam.
Okay. All right. Have you been having any illnesses so far?
No, ma'am.
Okay. What about past medical history? You have any past medical history, any chronic illnesses or anything?
Only thing is I've had asthma as a child growing up.
Okay. How long has it been since you've had an exacerbation of asthma?
I had my last flare probably 6 months to a year ago.
Okay. Do you take any medications on a regular basis?
I take albuterol.
Okay. What about any over-the-counter medicines, anything like that?
I take a multivitamin and I take a biotin.
Okay. Do you have any other medical conditions or is asthma it?
Asthma's it.
Okay. What about childhood illnesses? What kind of illnesses did you have as far as chicken pox, mumps,
I had
anything?
chicken pox, measles, mumps.
Okay, all right. And what about, we'll talk a little bit about your family history. Tell me what kind of illnesses your mom, dad, sisters, brothers had.
My mother has diabetes and high blood pressure. My father he's deceased, he died at 59. He had a history of multiple myeloma, diabetes, high blood pressure. I have one brother, he has high blood pressure.
Okay, all right. And what about your immunizations? Are y'all your shots up the park? Have you had the flu shot?
I have.
Okay, what about pneumonia shot?
I have not had the pneumonia vaccine.
Okay. Have you had any surgeries?
I've had hernia surgery and I had a cesarean section.
Okay, and what about any hospitalizations other than those two?
No, ma'am.
Okay. And what about any serious injuries, anything like that?
No.
Okay. Now we'll talk a little bit about your social history. Do you drink alcohol?
I drink socially. As far as cigarettes go, no smoking.
Okay. What about street drugs?
No street drugs.
Okay. What about your nutritional status? How is that?
Fair. I eat 2 meals a day.
Okay. When you eat those 2 meals, do you normally eat cooked meals or fast food?
I eat out most of the time.
Okay, eat out a lot. What about exercising? Do you exercise on a regular basis?
No, ma'am.
Okay. So we're going to have to get a little exercise in there, okay?
Yes,
all right. And tell me about your stress level. You have any problems with stress?
I'm stressed out right now because I'm in school, but otherwise I'm okay.
Okay. And what are you using as mechanisms for coping with stress? Nothing?
Nothing.
Okay.
Yeah, just dealing with it.
Okay. Do you have a good support system?
I do. I'm
okay.
married.
Okay, very good. Okay, so I tell you, if you're married, I know you are sexually active. Okay, that was one of my next questions. Okay. All right. Do you have any questions so far?
No, ma'am.
Okay. Well, we'll go ahead and start on your assessment, and I'm going to start with the head, and I'll tell you everything that I'm going to do, okay?
Okay.
All right. The first thing I'm going to do, I'm going to palpate and feel, and what I'm doing is just checking for any abnormalities to see if you have any lesions, bumps, or any bruises, anything like that, okay?
Okay.
And let me know if you have any tenderness at any part, okay?
Okay.
We're going to start with the frontal. Check the parietal, any tenderness anywhere.
No, ma'am.
And we're going to go back to the occipital, okay? I'm just looking at the scalp, making sure that everything is good with the scalp, okay?
Okay.
All right. Now, the next thing I'm going to do, I'm going to look at your nasolabial folds, which is right here, making sure that they're fine, and they are. Okay. I'm going to look at your fissures in your eyes. Okay, looks fine. Check this one. It looks fine. Okay. Now, the next thing I'm going to do, I'm going to check different cranial nerves to see how everything is going with those, okay?
Okay.
And the first one that we can start with, we'll start with the trigeminal, okay?
Okay.
And what I'm going to use a dull object, a sharp object, and a soft object, okay?
Okay.
All right. And what I want you to do, as the sharp object, we have a staple.
Okay.
Dull object is a paper clip, use the end, and then soft is going to be the tissue, okay?
Okay.
What I'm going to do, I'm going to touch your face at different places, and I just want you to tell me, close your eyes when I do this, and I just want you to tell me if it's sharp or dull, okay?
Okay.
All right, so close your eyes for me.
Sharp. 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 Ooh. Sharp.
I'm sorry about that.
Sharp.
Okay? Now, what I'm going to do this next time is I'm going to touch you on your face on on both sides. And when I finish touching on the second side, tell me if it feels the same or different, okay?
Okay.
All right.
Same. Same. Same.
Okay. Now, the next thing that I'm going to do, I'm going to take the paper that I have, and I'm going to touch it on different places of your face, and just you can just say now if you feel it, just to let me know that you feel it, okay?
Okay.
Close your eyes for me.
I feel it. Feel it. Feel it. Feel it.
Okay. And the next thing we're going to do is we're going to do another paper towel. I'm going to check your corneal reflex, and what I want you to do is just look up in the corner up there, and I'm going to touch your eye and just checking your reflex, okay? Okay. Do the other side for me. Okay. All right. That's fine. Wash your hands again. Wash your hands off. Okay. Now, we're going to move on to the facial cranial nerve, okay? And what I'm going to do now is check the muscle strength and everything. So I'm just going to have you to do different things for me, okay? And to add on to the trigeminal that we just finished, I want you to clench your teeth. And as you clench your teeth, I'm going to feel something for me. I'm just feeling your temporal muscles, okay? Release it for me, okay? And do it again. I'm going to check your masseter. Okay, all right, and that concludes the trigeminal. Now we're going to do the facial, and what I want you to do first of all is raise your eyebrows, okay, and relax it. Frown for me, okay, smile, okay, show me teeth, okay, and puff your cheeks out for me, okay. All right, that looks good. Next thing I'm going to do is check your lymph nodes, okay? All right, and we're going to start here. We're going to check your preauricular. Let me know if there's any tenderness.
Okay.
Any headaches or anything? Any tenderness in there?
No, ma'am.
Okay. Posterior auricular. Okay. We're going to check your tonsillar. Any tenderness?
No, ma'am.
Okay. Mandibular. Submental. Okay. Now we're going to come back here and we're going to check your superficial cervical. Any tenderness?
No, ma'am.
Okay. We're going to check your posterior cervical. Okay. We're going to check your deep cervical. Okay. And then we're going to check your, I'm going to move this just a little bit. We're going to check your supraclavicular. Okay. Any tenderness? Okay. All right. You have any questions so far?
No, ma'am.
Okay. Next, I'm going to assess your thyroids. Okay. And I'm going to look at it. And what I want you to do first of all, I want you to hold your head up a little bit for me. And I'm just looking, and I want you to swallow. Okay, very good. Now I'm going to feel, and I'm going to start for the high foot bone. Then I'm going to come right here and feel for your thyroid cartilage. Okay, your cartilage. It's fine. And then the thyroid gland itself. Now swallow for me. Okay, very good. All right. Now I'm going to check your trachea. And all I want you to do is just look straight for me. And I'm just going to feel on the sides. And all I'm feeling for is just to make sure that it's even, okay? And when I feel on the side, I'm just making sure that it's equal on both sides from the sternocleidomastoid muscle, okay? Okay, that's fine. That's fine. Okay. And the last thing that I'm going to do on that part is I'm going to give you a piece of candy. And this goes along with the cranial 5, and I just want you to put this in your mouth and let me know if it's sweet or sour, okay, when you taste it.
Sweet.
Okay, all right. Okay, so that's it for that part. So the next area that I'm gonna check is gonna be your thorax at the back, okay? All right, and I'm gonna have to pull your gown down a little bit, okay?
Okay.
Is that all right? All right. Now, I'm going to start off by inspecting, and I'm going to palpate just to make sure everything looks good and everything is normal and there are no abnormalities, okay? And make sure everything's, my hands covered? Make sure everything is symmetrical. Sorry about that. Okay. Okay. I'm going to listen to you. Okay. And now I'm going to, you're going to feel me tap. I'm going to do what we call percussing. I'm just listening for the sounds to make sure there's resonance, okay? And I'm going to go on both sides, and you'll feel me going all the way down. Okay. Now I'm going to do what we call tactile primitives, and what that is, I'm going to put my hands on you, and I want you to say 99 each time, and I'm going to go in different places for you, okay?
You want me to turn this way or stay right here?
You can turn around if you need. Yeah, that would help.
All right.
Very good. Okay. Okay. And when I put my palms on you, you can go ahead and say 99.
Okay. 99.
Okay.
99.
Okay.
99.
Okay. Now I'm going to pull this down a little bit, because what I'm going to do now is check for the thorax extension.
Okay.
And I'm going to do that by putting my thumbs at around T10, and I'm going to spread my hands. And what I want you to do is take a deep breath in and then fully exhale. Okay? Okay. And that looks good. Now, the other thing that I'm going to do is what we call diaphragmatic excursion, okay?
Okay.
And what I want you to do for me is you're going to take a deep, I want you to take a breathe in and then exhale. And when you exhale, hold it, okay?
Okay.
Go ahead and inhale, exhale, and hold it. Hold it for me. I'm going to make a little mark right here. Okay. Now you can breathe. Take a couple of deep, couple of regular breaths for me.
Okay.
Okay. And now we're going to do it again, but this time when you inhale, I'm going to tap, and I want you to hold it with the inhalation. Okay.
Okay.
All right. Go ahead and inhale for me. Sorry about that. Okay. All right. I'm just going to measure that. Okay. And that is good. It's about 4 centimeters, so that's good for us, okay?
Okay.
All right. Now, that's it with the back part. Now, what I'm going to do is I'm going to listen to you, and what I want you to do, the same way we said 99 before, I want you to say 99, and I'm going to listen to you, okay?
Okay.
And I'm looking for abnormalities with that as well. And then when I get through with that, I'm going to listen again, and I want you to say E. You just say E, E, and I'm listening then again, okay?
Okay.
All right? All right, go ahead and say 99.
99. 99. 99. 99. 99. 99.
Okay, this time we're going to say E, okay? Because just then I was checking for the bronchophony, and that was fine, okay? That was normal.
E. 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 E.
Okay, and that time we was checking for the egophony, and that was fine. It was normal, okay?
Okay.
Now, the next thing that I want you to do, we're going to whisper 99, okay? And just
Okay.
whisper it for me.
Okay.
Okay, and that time we were checking for the whisper, so that was fine, okay?
Okay.
So that's it at the back. The next thing we're going to do is lay on our back, and I'm going to check your lungs on the front, okay? All right. First thing I'm going to do, I'm going to inspect. I'm going to palpate a little bit. Okay, no problem. And I'm just going to listen. Okay. All right. You can go ahead and sit up for me, Miss Bond. All right. Now, I noticed you did say you had a history of asthma, and I did hear some wheezing up on your examination. When was the last time you used your albuterol inhaler?
I haven't used it in about 6 months.
Okay. Do you still have some, or do you have refills on them?
I may have a refill on them, but I'm out at home.
Okay.
I should have a refill.
Okay, and we will check, and if you don't, we will call you some in, because I want you to start that back up for that wheezing that we hear, okay?
Okay.
And I check your file when they triaged you. Your O2 sat was good. It was 99.
Okay.
So just start back up on the inhaler for me, okay?
Okay.
All right. Do you have any questions, any concerns?
No, ma'am.
All right. Thank you for choosing to come to visit with us. One more thing that I'm going to check is going to be your cranial nerve 11, which is your spinal accessory, okay?
Okay.
All right. And let me get you to turn around this way. Or I can come around here. I'll come around on this side. Okay? And what I want you to do with this, I'm going to put my hand up to your face, and what I want you to do is try to push my hand away, and I'm going to check your muscle strength, okay? And I'm just going to feel for any abnormality. Okay, that's good. And we're going to do the same thing with this one. Okay, that's good. And shrug your shoulders for me. Just shrug up, and I'm just going to hold it right there. Let me just feel. Everything feels fine. Okay, then shrug again, and we're trying to push my hands away. Okay, and that's fine. Okay, so you hadn't been having any problems with any headaches or anything like that. Okay, you hadn't been having any shortness of breath or chest pain, anything like that.
Every now and then I get short of breath.
Okay. So we make sure we start back up on that inhaler. And like I say, we will get you some more refills in so that you can go ahead and start back up on that. And I do want to see you back in a week. So I'm going to schedule an appointment to come back in 1 week to follow up with us to check on those wheezes, okay?
Okay.
All right. And again, thank you for choosing to come visit with us.
Okay.
All right. Thank you.
All right.